my name is Julie Byrne, and I'm a peer consultant for Shadow Health. I'm also a nurse practitioner and a nurse educator. I believe that you can learn a lot from interviewing and assessing these virtual patients, and today I'm going to walk you through a complete health history. First, I'd like you to understand a little bit about our patients. These assignments are learning tools, and they're designed to allow you the luxury of time to practice. So when your time is limited, you will be able to perform a high-quality, time-effective assessment. The patient exams will often take you over an hour to complete. Some students get caught up thinking about the length of time that the exam takes and forget that it's a learning tool. Okay, let's get started with the assignment. We can begin by understanding the importance of a thorough health history. A health history is a record of information about a person's health, and it's compiled by doing a thorough interview. It includes information about allergies, past and current illnesses, surgeries, immunizations, and a family and social history. It also includes information about medication and health habits, such as diet and exercise. Let's greet our patient and start with the interview. You should greet your patients by using Mr., Ms., or Mrs. and their last name. You should also tell them what your name is and what your role in their care will be. Hi, Ms. Jones. My name is Julie Byrne, and I will be your nurse for today.
Hello.
Let's start by getting an understanding of the history of present illness. The history of present illness, or HPI, is important because it allows you to understand why the patient is seeking care. In general, it is a detailed, chronological description of the development and progression of the patient's present illness from the first sign and symptom to present. I always like to start with open-ended questions. It allows the patient to tell you what their understanding of their current situation is. So for example, instead of saying, "So I hear you have a wound on your foot," to which the patient would likely just reply yes, asking in an open-ended way allows your patients to give whatever information that they feel is important. So instead of saying that, I would just say, "What brings you to the hospital today?"
I got this scrape on my foot a while ago, and I thought it would heal up on its own, but now it's looking pretty nasty, and the pain is killing me.
Ms. Jones is telling us that she's in pain. This is a great time to practice empathizing with her. I'm going to select the Empathize tab and then make an empathetic statement. This helps to build rapport and trust with the patient. It is important to note that these statements will be a part of the overall picture of your interaction with our patients when looking at your results. When you are using the education and empathy features, it's important to note that you are not graded on the exact words you use to educate or empathize, but rather you are assessed on the timing of your response. I would not earn the point if I moved on in my interview and asked a couple more questions and then remembered to come back and empathize with Tina. You should offer education and empathy immediately after it's warranted. I'm sorry you're in so much pain. I'm glad you're here so we can help you.
I appreciate that.
Let's move on to get more information about Ms. Jones' foot. We are going to begin to qualify her symptoms and get more information on her injury. I like to use the Old Carts acronym as a reminder of what to ask. So that's OLDCARTS. O is for onset, L location, D duration, C characteristics, A aggravating factors, R relieving factors, T treatments, and S for severity. I think you get the idea. You would continue to get all of the information necessary to give you the entire picture of the current situation. So for example, we would ask, when did the pain start?
Well, I got the scrape a week ago, but the scrape and the pain got a lot worse in the last few days.
Where is your wound?
It's on the ball of my foot.
Can you rate your pain on a scale of 0 to 10?
Like a 7. It hurts a lot, but whatever pain med the ER gave me is helping a little bit.
All right, now sometimes our patients aren't going to immediately understand what you're trying to say. And like a real patient in your clinical work, you may need to rephrase so they understand. So let's go back to our last question. We asked about pain. So if I said something instead like, rate it 0 to 10. The patient's not going to understand, so you can read through the 4 statements. These are clarifying statements, and decide if you can rephrase to one of the questions offered. You can see that we could choose this one or maybe even a couple of the other ones, but I'm going to go ahead and choose the second one.
Like a 7. It hurts a lot, but whatever pain med the ER gave me is helping a little bit.
And you see we get the same answer. So just a couple more things. Additionally, the virtual patients may struggle to understand your questions on some occasions. The shadow health patients do not have a working memory, which means that they cannot draw context from the conversation to answer your questions. So because of this, you want to make sure that every question you ask can stand on its own. You want to make sure to review the tips that can all be found underneath the question mark box to the left of the text box in all of our assignments. These tips are also helpful when talking to non-virtual patients, so they're really helpful across the board. I'm going to go through them for you. Number 1, use correct grammar and spelling. Number 2, avoid pronouns. Number 3, avoid jargon and abbreviations. Number 4, give context when asking questions. Number 5, avoid sentence fragments. Number 6, ask about one subject at a time. And finally, remember to use those Educate and Empathize tabs. I am not performing a complete patient interview, but rather just demonstrating how I would begin each section of the health history. So let's move on to the next thing, which would be the past medical history. The past medical history, sometimes abbreviated as PMH, is the total sum of the patient's health status prior to the presenting problem. You want to ask about pre-existing medical conditions, prior hospitalizations, medications, allergies, and immunizations. At this point, I want to call your attention to our interview guide feature. The interview guide is an optional feature your instructor can choose to enable or disable. The interview guide, if enabled, will appear on the left-hand side of your screen and will provide you with real-time feedback on your interview progress. As we go through this section, watch how the number of findings discovered increases. Do you have any other medical conditions?
I mean, I have asthma and diabetes, but right now I just care about my foot.
All right, let's just take a minute to briefly empathize with Ms. Jones again before we move on. I'm sorry you're in so much pain. I will get you pain medication as soon as possible.
Thanks a lot.
Okay, let's continue on with our interview. Let's start getting more information on her diabetes diagnosis. When were you diagnosed with diabetes?
I was diagnosed when I was 24.
How are you managing your diabetes?
I try to stay active and avoid sugar, and that seems to be working well. I feel better now than when I was taking diabetes medication.
Do you take any diabetes medication?
No, I don't take anything for my diabetes anymore.
Why did you stop taking your diabetes medication?
I just got sick of dealing with it.
Are you monitoring your blood glucose?
I have a monitor at home, but to be honest, I don't really use it that often.
All right, so you can see Ms. Jones will require some education regarding the proper care of her diabetes when you are conducting your assessment. You would then want to continue asking about her symptoms such as thirst and urinary frequency, weight changes, and diet. You would then go through and ask questions that would enable you to get a full understanding of her asthma and its management. You'll then need to move on to asking about allergies and immunizations. You have to be specific to make sure you're getting the whole picture. So let's go ahead and ask a few questions. Have you had all of your childhood immunizations?
I'm pretty sure I received all my vaccines as a kid, like before registering for school.
All right, now let's get a little bit more specific. Have you received your flu vaccine?
No.
All right, you could provide some education here for sure. Because of the nature of Miss Jones' injury, we should also specifically ask about a tetanus shot to make sure she doesn't need to get one. When was your last tetanus shot?
I got a tetanus booster about a year ago.
Finally, you need to ask about all of her home medication use. Do you take any medications at home?
I don't take anything, unless my inhaler counts.
That definitely counts. You will need to get some more information on that while you're doing your assessment. Finally, don't forget to ask about any non-prescription medications as well. Do you take any over-the-counter medications?
I take Tylenol for a headache sometimes, or Advil for cramps, but not often.
All right, I think you get the feel for the past medical history section of our health history. We can move on to the social history. A social history is a portion of the medical history addressing occupational and recreational aspects of the patient's personal life that have the potential to be clinically significant. In this section, you're going to ask about the patient's level of education, who they live with, religious views, and recreational drug, alcohol, and tobacco use. Let's go through a couple of the trickier ones. Have you ever smoked cigarettes?
No, I think it's gross.
Remember to be specific so you're getting all of the information from the patient. Have you ever smoked marijuana?
Well, I used to smoke pot, but I don't do that anymore.
All right, let's ask about other drug use. Have you ever used any other drugs?
No.
And now we can practice quantifying alcohol use. Do you drink alcohol?
I do sometimes, yeah, when I go out with my friends.
How often do you drink alcohol?
No more than once or twice a week, sometimes less.
All right, let's move on to the family history. A family medical history provides insight into the conditions that are common in the patient's family. This history can be used to understand the risk of a patient getting certain familial linked diseases such as heart disease, diabetes, and some kinds of cancer. The family medical history is a record of illnesses and medical conditions affecting your immediate family members and generally should include 3 generations to provide a complete picture. Let's ask her about diabetes since we already know she has that. Does anyone else in your family have diabetes?
Dad has sugar diabetes, and I think my Grandpa Jones did too.
Okay, so we can note that both Tina's father and paternal grandfather have diabetes. Let's ask about her mom. Does your mom have diabetes?
She doesn't have diabetes. It was Dad who had it.
I don't feel like I completely understand enough to chart yet, so I'm going to ask one more clarifying question. Do all of your grandparents have diabetes?
Grandpa Jones is the only one of my grandparents that had diabetes.
Okay, I think we now have a clear understanding about who in those 3 generations is diabetic. You would continue on with the family history. Don't forget to ask about her brother and sister as well. A review of systems will help to elicit a full medical history from a patient. Most of the answers to the questions that you're asking will be no, but it's important to go through the entire inventory to ensure that nothing is missed and you're going to get the complete medical picture. So go through each of the body systems. I like to start from the top and work my way down, meaning start with the head and work my way down to the toes. Do you ever get headaches?
Yeah, I get them a lot when I'm studying.
Do you have ear pain?
My ears are fine.
Do you have any vision problems?
I've actually been noticing problems lately. When I'm reading or studying, I'll notice that things start to get kind of blurry.
All right, so she's definitely telling us some things that we're going to need to address. Make sure to document all of this before moving on to the rest of the review of systems. Don't forget to also ask about mental health and women's productive health.